Attention Deficit Hyperactivity Disorder, ADHD, as defined by the American Psychiatric Association in 2000, is characterized by the persistent and elevated levels of inattention, hyperactivity, impulsivity, or both that cause impairment in a child's life. According to the Diagnostic and Statistical Manual of Mental Disorders, to meet criteria for this diagnosis, a child must display 6 of the 9 symptoms of inattentiveness. Example, be easily distracted, lack attention to details, and have trouble maintaining focus, or display 6 of the 9 symptoms of hyperactivity and impulsivity, be unable to sit still, have trouble waiting their turn, or interrupt and intrude others. The previous guidelines for diagnosing ADHD were limited to children ages 6 to 12, but recent advances in research have expanded the guidelines to include children ages 4 to 18. This is important for us as teachers because many of our students will now come into kindergarten already being designated as having ADHD. However, as we know, attaining these designations and getting the proper resources can be a very timely process. Furthermore, these symptoms must be consistently shown in at least 2 different settings, example at home and at school, to a degree that impairs the child's functioning. It is estimated that ADHD ranges between 3 and 9% of school-age children. Thus, a typical classroom of 20 children is likely to contain at least 1 or 2 children with the disorder. ADHD can also be found in combination with other disorders. It is estimated that approximately 8 to 20% of children with ADHD also have a learning disorder. 33% also have an anxiety disorder, 25% have depression, and 55% also have operational defiant disorder or conduct disorder. University professors from Australia and Canada, 2 of which were from Kelowna, Linda Allen and Melanie Strain, looked at how labeling students with ADHD affects teachers and students' attitudes and their intentions with students. Since the diagnosis and label of ADHD can have a huge impact on the child and the people in their lives, it is important for us as teachers to understand how it influences our attitudes and beliefs. For teachers, placing such labels or diagnosis has effects that reach beyond the classroom and into the home. Being sensitive and educated about ADHD is crucial for teachers. In a recent large and representative sample in the United States, adults felt that teachers were a better source of advice for parents on childhood psychiatric issues, including ADHD, than were psychiatrists themselves. With that said, it is the choice of the parents whether or not they want to disclose the information of a child's ADHD diagnosis at school. Therefore, as an educator, it is important we have an open and understanding relationship with parents in order to be entrusted with such crucial information about our students. In turn, it is the role of the teacher to provide the medical professionals with valuable information about the child's educational setting. This is an important collaborative relationship for providing the student with the best possible resources and treatment.
When it comes to ADHD and learning, students may have a very difficult time. Early diagnosis is critical to minimize problems children with ADHD will encounter in academic activities. Students often find it hard attending to one thing at a time because they get distracted very easily. When in class, it may seem like the student is paying attention, but they might be focusing on other things around them, like what the teacher is wearing, what their glasses look like, or the color of their shoes. Another thing children with ADHD have difficulty doing is following directions. They often get distracted and forget what it is they were asked to do and therefore do not complete the task. This can lead to the teacher getting frustrated and misunderstanding why the student did not do what they were asked and, in result, punishing the student. Also, students with ADHD have trouble mastering skills. Their diminished attention capacity may impair their ability to focus on and master basic skills, especially in mathematics. This also can have a negative effect on their ability to learn new facts or knowledge in other subjects. Because they have such a hard time focusing their attention on one thing for a prolonged period of time, they also struggle when it comes to finishing work. Another problem for children with ADHD is they often forget rules and, in result, fail to follow them. They are then seen as defiant troublemakers by teachers and peers. As a result, to students' inability to concentrate, and accomplish tasks, roughly one-third of children with ADHD will be held back one grade, and around one-third will not graduate high school. When it comes to supporting students with ADHD, teachers have numerous strategies to work with. The most important fact to remember is that all students are different and that every child is unique. However, when it comes to creating rules, they should apply to the entire class. Students with ADHD need to have structure and routine so they know what to expect. If students know what to expect, there's a less chance of becoming anxious throughout the day. When students don't follow rules, there needs to be an agreed-on consequence. This should apply for the entire class because it creates a good structure not only for the students with ADHD, but for other students as well. Another important strategy to support students is to give instructions in small parts. This will help avoid confusion when the students are carrying out tasks. They will be less likely to get distracted if they only have to follow one instruction at a time. Also, when giving instructions to students with ADHD, it is best when they are very specific. Students can become confused if the directions are unclear, and this can lead to frustration. Implementing these strategies in the classroom can help students with ADHD not only learn better in school, but have fun while doing so. It is most successful when the parents, school, and medical professionals are involved.
Along with academic difficulties, students who struggle with ADHD also face many challenges throughout their day in social settings. People with ADHD may have more trouble focusing on holding conversations because they may not be able to listen to the speaker or frequently interrupt. They may also get frustrated waiting in lines or taking their turn in organized games or activities, which requires including others. Students who act this way may be feeling a few different emotions. A student may act shy and quiet and stay to himself or herself, or they may be loud, talkative, and want all the attention on themselves, or they may feel angry and overreact to certain situations. These are all negative social behaviors which are broken down into the 4 categories of social noncompliance, isolation, verbal aggression, and physical aggression. These students have difficulty controlling behavior and emotion and could use some help and support in their classroom environment. There are multiple strategies that teachers can turn to and try to help individuals with ADHD. Teachers may be able to strengthen good behavior by pointing out examples of positive interactions and praising. Most of the time, students with ADHD are often not aware of their actions and behavior. These students need a reminder of how to recognize appropriate behavior. For example, at some schools, social skills training is provided to educate them about appropriate social skills and teaching them how to use them in real-life social interactions. But not all schools are gifted with such a program, and for that, it is up to the teacher to implement a few strategies. A good idea is to set up social behavior goals with a student and create appropriate behavior signals with them, either verbally, written, or using a hand signal. The teacher could also encourage the ADHD student to watch others who present appropriate social skills. Other possible strategies include, but are not limited to, assign special responsibilities to the student, use self-talk, visualization, allow movement, provide opportunities for hands-on learning, expressive arts, peer tutoring, class meetings, and more. Giving structure helps ADHD students find success, provide clear and concise information so they do not get overwhelmed.